It's Dr. Oop here. I'm feeling a little under the weather right now. The winter months are upon us, although it's December and finally getting cold here in Texas. So the cold and flus are finally coming around, although flu season doesn't really peak in Texas until February, March. But this video is for whoever wants to watch this, wherever you may be. And so what I want to do is give you a couple tips on what I do when I have a cold or feeling like I'm coming down with something, and just kind of give you some basic tips and guidance. Because when you go over the counter, if you have a cold or flu, you're going to see tons of marketing things. You should take this is better, take that. And I think the number one thing I want to steer you against is steer you away from taking the combo packs. The more adjectives in the combo pack, like coughing, sneezing, runny nose, fatigue, the more combination stuff they put in there. And sometimes people start feeling worse just because they're taking a myriad of different drugs. So when you go shopping over the counter, I would like you to take specific items and take one ingredient items. That way you can kind of make your own cocktail for what you're suffering from. So the main symptom that comes with a cold is a runny nose, and what most people don't realize is the runny nose is actually what's triggering the cough that comes with a cold. And so we call this a postnasal drip. You've probably heard that phrase used. And all that means is that the mucus in your nose is collecting and it's kind of oozing down the back of your throat, as disgusting as that sounds. And as it oozes back to the back of your throat, it drips into your lungs. And when it drips into your lungs, it triggers a cough, which is normal. That's supposed to be there. A cough protects you from a pneumonia. So I don't usually encourage people to go after a lot of the cough medicines, because if you're suppressing the cough, that means more that mucus is going to build up in your chest. And if you don't want it to move down to your chest, then you should probably be coughing in order to keep it out of your chest. The other thing a cough protects you from is a pneumonia. If you're sniffing all that stuff down and inhaling it all, but you're not coughing it back up, then that's increasing your risk of pneumonia. So if you try to treat the runny nose and try to limit that by blowing it or doing whatever you need to, then you're less likely to have a cough and you're less likely to have the mucus. So the main thing I like to take for the mucus and runny nose is called Sudafed, or pseudoephedrine is the generic name. This, most people get tricked up because it's behind the counter at the pharmacy. It is a over-the-counter drug, but they keep it behind the counter. And the reason why is because you can cook it to use meth, apparently. And so they keep it behind the counter, and you got to swipe your driver's license in order to pick it up. But it is the best one out there. The Sudafeds that you see in front of the counter, meaning just on the shelf, usually don't actually have pseudoephedrine. The best one, as far as the studies go, is pseudoephedrine for the nasal congestion. Pseudoephedrine is a stimulant. It's a very mild form of Adderall and all that, basically. And so it does raise your blood pressure. It does raise your heart rate. And so people are always scared to take it if they have high blood pressure. Most people can take Sudafed without any problem. But if you are having issues with blood pressure and heart failure and all that, then you should probably be cautious and talk to your doctor about it. But most people can take Sudafed without any problem. Because Sudafed is a stimulant, it does keep you awake, and so you can't take it at night and expect to sleep. And one of the important ways to be able to beat a cold in time is to have a good immune system to be able to fight that cold. If you're not sleeping well, then you're definitely not going to fight it. So on that note, make sure you're sleeping enough. If your body is tired, then don't just take Sudafed and push through. If you're tired, you probably need to sleep. So if you need to take time off work, go take a nap, whatever. If your body's tired, please listen to it. Take a nap. I like to get the non-extended release pseudoephedrine or Sudafed, because that way you can take it throughout the day and you aren't stuck with it if you don't need it. So there's a 60 milligram tablet that's non-extended release, and you take one or two of those pills in the morning, and then if by noon, 2 o'clock or something, you still have the runny nose coming back, then go ahead and take a second dose. Then in the evenings, when you're ready to go to sleep, you don't want to take the Sudafed because that's going to keep you up. And so what you can take in the evenings is Benadryl or diphenhydramine. That's the basic component in NyQuil and Tylenol PM and all that stuff. It's just Benadryl, and Benadryl's side effect is it makes you sleepy. The other benefit of Benadryl is that it's very drying to the nasal cavity, so it will dry up a lot of the mucus in your nose. And so if you notice you're frequently waking up in the middle of the night just because you're breathing through your mouth or you're so congested that you can't sleep, then I'd really encourage you to take Benadryl, because just like I talked about a second ago, if you're not sleeping well, you're not going to fight the cold very quickly and you're not going to feel energetic the next day. So taking the Benadryl can both help with the sleep and it can help with the mucus buildup. But once again, don't take anything if you don't need it. If you're experiencing a lot of sinus pressure and sinus pain, then it may be a good idea to take some Tylenol or ibuprofen. Once again, don't get the combo packs, just take Tylenol or ibuprofen by itself, and that usually helps with that. The sore throat can be a little troublesome. Motrin or ibuprofen usually works pretty well for the sore throat, but that is often tricky. Many people try to use the lozenges and the stuff that numbs your throat, but the problem with those is studies have shown that while it helps numb your throat, when it wears off, it's actually more painful than it was before if you had never taken anything. So the actual recommendation right now is probably to stay away from those unless the sore throat is terrible. Oftentimes I'll tell people to use them if they're having trouble drinking or eating anything and their throat's so painful that they just can't keep liquid down. Dehydration will make you feel horrible, so go ahead and pop one of those lozenges or do one of the sprays to numb up the throat. That way you can go ahead and drink and eat anything you need to, so you can stay hydrated and energetic. I've got a couple products here that I want to talk about that I usually use for cold and flus. So the first one I'm going to mention is vitamin C. Everyone knows about vitamin C. So this one's ascorbic acid from Pure Encapsulations, and it is 1,000 milligrams per capsule. And so when you're sick, it's okay to take some extra vitamin C. 1,000 milligrams twice a day is the usual regimen. This is what's made Emergen-C famous, of course. And their powders are usually 1,000 milligrams twice a day too. So those are good. Another thing I like to use is NAC. You've probably heard me talk about that multiple times. NAC helps build glutathione, but that's not really why we're using it here. NAC has been shown to break up and reduce mucus, kind of make it thinner. And so we actually give it to COPDers, people who have lung issues and are having trouble getting their mucus out. We can nebulize it and let them breathe it in, and it breaks up the mucus inside their chest and helps them cough and get it out. And so NAC is a great supplement to help loosen up some of that mucus if you're having it. Now, it is a cold. You are still going to have mucus, and remember that it's breaking up the mucus. So you might feel like you get more mucus after you take it, but the idea is that you're getting it out of you and it's not staying in you, because thick mucus that doesn't go anywhere is a setup for infection. So we'll talk about infections in a second. The last one you can take is glutathione. And so glutathione also helps with breaking up the mucus and improving your antioxidant, anti-inflammatory abilities. So glutathione can help you feel better. If you're suffering from frequent colds and frequent issues, then you can take kind of an immune stimulator like Immucor from Metagenics. The immune stimulators are usually mushrooms mostly. So this one's got reishi, shiitake, fuling. I may not be saying these correctly, but the mushrooms that stimulate the immune system. And so that's not so much used for the cold that you're suffering from right now, but if you're noticing you're getting frequent colds or bronchitis or whatnot, then you should probably start a mushroom supplement like the shiitake or Immucor supplements. One thing I really like to use for people who are suffering from thick mucus that's kind of stuck in their sinuses and not really moving, they can blow their nose as much as they want, but that mucus just isn't coming out, or it's so thick they're having trouble getting it out, it's actually a sinus rinse. I don't know if you've seen these. These are made by NeilMed, and this is basically a water bottle. It's a squeeze bottle, and you take the salt packet, and this is a pre-made salt packet that's pH neutral, and you dump it in here, and then you add some clean water up to the dotted line, and then you spray it inside your nose, and the idea is that you're washing out some of the mucus, and although that mucus is really thick and globbed up in there, if you thin that mucus and make it more water-like, then it'll just ooze out on its own, or it'll be easier to blow out. The other reason why I like these instead of the neti pot is when you do those, it kind of forces the water in there and it hydrates the sinuses, whereas the neti pot that you just lean over and pour in, it kind of goes in the nostril, goes across the septum, and just comes out the other nose, and so it's not as beneficial as really getting into the sinuses. So that's something that I like to use, especially when the mucus is just kind of trapped up in there. If you want to kick it up a notch, especially if you're someone that suffers from chronic sinus infections or recurrent sinus infections, or every time you get a cold it turns into a sinus infection, you can actually add some bacterial killing agent inside of it. So this is called Biocidin. It's basically a combination of herbs that are known to kill bacteria: bilberry and milk thistle, echinacea, golden seal, shiitake mushrooms, once again, grapeseed extract. And so that combination helps kill bacteria. So what you can do is you can add 3 or 4 drops. This is a liquid. You can add 3 or 4 drops to your sinus rinser when you squirt it in there. You still need to put the salt packet in there, but you can add that bacterial killer in there, and it'll help get rid of some of the bacteria and stuff going on in your sinuses, especially if you're someone that's prone to it. Now, if you wait until your sinus is infected, typically that means the sinus is completely blocked off and you can't get fluid in there. And so if you wait to use this until that happens, it's pretty much too late and you might end up on antibiotics anyway. But if you can start doing this before, then you can get that stuff in there and it can break up the biofilms. Biofilms are critically important for people that have chronic infections or recurrent infections, because you can take antibiotics and it will often treat the infection and your sinus will get better, but many times you'll be left with this biofilm that's still stuck there and hasn't gone anywhere because the antibiotics can't quite penetrate the biofilm. And so basically that biofilm is just waiting for the right opportunity for you to develop enough mucus for them to feed off of it and them to create an infection again, basically. And so if you're someone that suffers from recurrent sinus infections or chronic sinus infections, I'd encourage you to do this on days even when you're not sick to try to kill that biofilm. That's one of the main things that's been studied to and proven to do is reduce biofilms. The last thing I want to leave you with is don't overuse antibiotics, guys. Our gut and microbiome are one of the most important things you have in your life, and if you're constantly taking antibiotics for sinus infections and sinus issues, then you're destroying that microbiome, and by destroying that microbiome, you're creating more inflammation and making things worse, and so you're going to keep getting recurrent sinus infections if you do that. And so the basic requirements that I would encourage you to seek treatment or need antibiotics for is if the duration of the cold is lasting 10 days, and so 10 days is a long time. Mark the start of when your symptoms started and say, before 10 days, I'm not going to start any antibiotics. Don't even seek help until day 10. If you're experiencing fever, or if you're experiencing sinus pressure and sinus pain, then that may be something that means you need to get treated with antibiotics before then. But almost all sinus infections will go away on their own. You don't have to have antibiotics to treat a sinus infection if you're just patient and wait it out. Your body will most of the time take care of it. But once again, consult your doctor. So you can get sinus pain and sinus tenderness even with a virus. I had a lot of sinus tenderness last night with this cold, and it's gone this morning. So every time your sinuses hurt doesn't mean you need antibiotics. Please be patient. Try some Biocidin, try some sinus rinses, and see if you can get away with it naturally. That's most of the tips I have for you. Hopefully this video will help you treat your next cold. Hopefully you won't get a cold, and hopefully it'll be a little less bothersome the next time you get one. So if this video is helpful, please like and share it with someone you know who may be suffering right now, because it's easy to get lost over the counter when you're looking at all the products over the counter. So I hope you guys have a good day, and I hope none of you have to suffer from a cold.